I feel so privileged to follow behind my incredible boss, Secretary Becerra. I don't think I have to do anything to convince this room that we have an incredible champion who thinks every single day about what he can do for older adults and the aging community, and it is just so incredible to have that wind behind our back. I also want to give another shout out, I'm glad the Secretary did, to our amazing Deputy Assistant Secretary, Edwin Walker. I have told him I'm going to embarrass him at every single conference between now and the end of the year when he is retiring. So if people could just give one more round of applause for Edwin. And I really want to jump off the Secretary's thank you to all of you for your incredible partnership. He knows big picture, but let me just say a few of the many ways that we appreciate your partnership. Everything from the work we're doing together around evidence-based programs and falls prevention and chronic disease self-management, nutrition, senior centers, reaching underserved communities, direct care workforce, housing, and as he mentioned, our work together around vaccines. Thank you to the NCOA Center for Benefits Access for your incredible work around the National Centers for Benefit Outreach and Enrollment. And I want to give a shout out to our MIPA state grantees and the benefit enrollment centers who are here for all of your incredible work to help people navigate the Medicare Savings Program, the Extra Help Program that the Secretary just mentioned, SNAP, and so much more. Just to highlight a little your reach, in the last 6 months, the BECs have reached almost 200,000 people and assisted with applications. And over the last year, the MIPA grantees have had over 1 million contacts. To really take what the Secretary said, you are the ones reaching people who are hard to reach. I want to talk a little bit about some of ACL's priorities and the ways that we are and can continue working together. As the Secretary mentioned, COVID has been front and center, and we know that over time this has turned more and more into a pandemic that has been affecting older adults. And you have been key partners. I want to assure you that the money that we got as we were trying to fight for the money that was left, we were at the table because the Secretary said older adults and people with disabilities have got to be a focus. We were there because you all had done such an incredible job with funding we'd gotten early in the pandemic. All I had to do was tell him what our incredible networks can do with just a little resource. They always call us the problem solvers. You give us a little money and we can go a long way. And truly, that $50 million that NCOA is helping implement with a focus on senior centers, and Ramsey and I have gone together to a number of senior centers. Make sure you don't wear a suit to do the exercise classes in a mask. Rookie mistake. But it's incredible, truly, the work that you are doing reaching people. We're in a new phase, and you have a really important role to play. Now that the public health emergency has ended, we have work to do together to make sure that people do not lose health care coverage. And this is such an important place where MIPA grantees and BECs play such an important role to make sure people do not fall through the cracks, to make sure people, if they are no longer eligible for Medicaid, know how to get other health insurance options. You also are playing a really important role in states as they are starting to look at their home and community-based programs and the flexibilities that had been in place and what they plan to put in place long-term. The two things we hear from the Aging Network more than anything else around unwinding is around paid family caregivers who have been critical to helping older adults stay in their own homes, and something that we know so many of you are advocating on, and this critical hunger cliff that people are about to face because of a reduction in SNAP benefits, and we know more and more people will be relying on the nutrition programs provided by our networks. We are all working together closely, and we have got to stay focused. We have a whole set of resources on acl.gov and unwinding page, and we really look forward to working with you to make sure no one falls through the cracks. As Ramsey mentioned and the Secretary mentioned, you all are playing such an important role in these new benefits as part of the Inflation Reduction Act. And just this morning, literally right before this conference, timed well, a fact sheet came out about the ways that ACL's networks and CMS are working together to make sure that we reach people to know about the Extra Help program. So I'm going to call on you just like the Secretary did. People won't know about it if we don't tell them. Our Office of Health Information and Counseling in ACL will be working with NCOA and SHIPS and MIPA grantees, and we need you to get the word out. Another top priority for ACL, for the Secretary, and for the President himself is ensuring that we have a strong care infrastructure made up of both paid professionals and family caregivers. And I am so pleased to see, Ramsey, that NCOA has joined and is part of the Act on Raise Coalition. It was incredible for all of us to listen to the President's State of the Union. And all of us probably always listen for one little nugget that's about our community. I don't think any of us expected minutes focused on our issues, about how to help older people age in place, about the direct care workforce crisis, about supporting family caregivers, and expanding home and community-based services. And we have got to work together because more than ever, COVID has shone a light on why it's important to support people to age in place and to prevent them going into congregate settings. People want that more than ever, yet at the same time we have a direct care workforce that's in crisis, leading to more than 80% of home and community-based providers declining referrals, and more than half closing services when the demand is more than ever. When Build Back Better did not come to fruition after we picked ourselves up off the floor, we said, we might not have billions, but we have got to search our couch cushions to do important things. And we were able to find some funding to launch a direct care workforce capacity building center. And I'm so pleased that NCOA is leading that workforce center together with 11 aging and disability and workforce labor organizations. All boats rise together, and we have got to use every tool in our toolkit. We have got to have a broad coalition, and we are so excited about the work we are doing, both lifting up best practices and building those partnerships at the state level. Our work helped catalyze what the President put out just last month, the first ever care executive order, focusing on more than 50 directives to federal agencies about how to support direct care workers and family caregivers. And the incredible work that ACL is doing around the National Family Caregiver Strategy and our Direct Care Workforce TA Center were front and center in there. And we worked in partnership with the Centers for Medicare and Medicaid Services on a new rule that's out around access, because we can have the best home and community-based services and great systems, but if you can't get what you need when you need it, it doesn't help people. And so this new rule that's out for public comment right now, and I hope that NCOA and the Leadership Council on Aging are going to make their voices heard, take important steps around strengthening the direct care workforce and addressing the quality of home and community-based services and dealing with issues like wait lists. To live in the community, people don't only need services, they need access to affordable and accessible housing. And that's another place where ACL has stepped up in partnership with agencies across HHS and with HUD. We have seen a huge growing population of older adults who are becoming homeless. And we have got to see this as one of our issues. 1 out of every 10 low-income families and older adults can access affordable housing, and only 5% is accessible. So we have a lot of work to do. That's why we launched the Housing and Services Resource Center in partnership with HUD, and I am so grateful to see so many of your organizations at the table working on those issues with us. We are about to do a really big thing, hopefully in a number of days that you can count on one hand. For the first time in more than 30 years, we will be updating the Older Americans Act. It was something that Edwin said that we had to do before he left, so there's been a mixed motivation here to kind of slow roll that, but it's huge. It's huge. It's what we've been hearing from the field. We've had 7 reauthorizations, a bunch of new programs, and we know what works in the field, and it's time for us to make that really clear. So, truly soon, you will be seeing a notice of proposed rulemaking coming out, and it's really, really critical. I want to just give a couple highlights from it, and I know that Ramsey and Howard and others will be helping you comment, and your voices are truly, truly critical, but we will be updating and aligning with the law. We will be really focused on what do we mean by greatest social need, and really aligning that with our values about reaching underserved communities. We're going to highlight the coordination between Title III programs and our tribal elder programs under Title VI. We're going to talk about the kinds of things that you have been asking us about, things like conflicts of interest and business acumen. Preparedness. We learned so much through the COVID pandemic, and it's time that we update our regulations to really incorporate that. Caregiver programs, they didn't even exist the last time we updated the regs, and it is so pinnacle to the work that we are doing. And then an issue that's come up again and again and again, and I see Kathy sitting here, one of our real leaders around elder justice and strengthening elder justice, thinking about the important roles that our networks play around self-determination and alternatives to guardianship. So when it comes out, I want to remind you, we need your feedback. There's a formal way to do it, and we will really look forward to getting this over the finish line. But we're not just stopping with Older Americans Act. No regs have ever been put out around adult protective services, and it is time for us to create some basic federal guidelines. So a few months behind the Older Americans Act regs, we'll let you focus on one before you have to turn to the other, but we have got to get these done in this first term. And it really is timed, and because of your incredible advocacy, it is the first time in fiscal year 23 appropriations that we have gotten ongoing funding for adult protective services. So if we're going to give you funding, we need to set some basic regulations. And I think most states will be really appreciative of this. You've been part of helping us develop voluntary consensus guidelines, which really forms the basis for these rules that we're setting, to set some consistency and really will give us some opportunities to give technical assistance to the incredible programs that are out there. Finally, I want to end by one thing I know that we have in common and that NCOA has been such a leader on, and that is our efforts to reach all communities. In the disability world, we always say all means all, And I think that's one place where in my work with the aging communities, we have really start off with shared values. And the beautiful thing about the Older Americans Act is it commands us, it directs us to reach the most underserved in our communities. And that really aligns with the order from the president from day one that we need to focus on equity in everything we do. And we need to recognize older adults are also parts of the LGBTQ community. They come from communities of color. They may not speak English as a first language. They may live in rural areas, and we need to identify and address those unique barriers. My job in HHS is to make sure that in everything we are doing around equity and health disparities, that we put this intersecting lens and say, what about older adults? What about people with disabilities? And just to give one example of what we are trying to do even with our own programs is equity assessments and program evaluations through MIPA to make sure we are reaching people who need help the most. So I want to just end by saying thank you. Thank you for your incredible partnership. Thank you for giving us the wind behind our back. And I want to just foot stomp the call to action that the Secretary said. Our work is not over. We have a lot to do, but it is easy to do with great partners. So thank you.